The following show is brought to you in partnership with the Institute of Politics, Policy, and History, Blue Star Strategies, Bright Road Incorporated, Make It Plain Podcast, and RPC Media.
From the campus of the University of the District of Columbia, this is State of Play.
Welcome to State of Play. Our topic today, the status of Black women in America. A lot of people say, well, why do you need to talk about it? You've got Kamala Harris, a heartbeat away from the presidency. You've got Stacey Abrams being considered for Nobel Peace Prize. But I think we all know that's not the real deal. Today, we're going to really drill down on the real deal. And I think we all know we need to do that. Don't you agree, Karen?
Yes, Mayor. I'm really looking forward to our show today. We've got a lot of experts and, Black women clearly were hardest hit because of COVID. But that hard hit has gone on long before COVID hit the United States.
Indeed. And you mentioned Kamala Harris and Stacey Abrams, Mayor, but we all know that individual accomplishments don't always translate into what the collective are dealing with. And I think we'll find in this episode that still ongoing and for far too long, Black women comprise disproportionately too much of the bad statistics and disproportionately too few of the good statistics when it comes to the economy and health and even politics.
Right. And health is right up there, is it not? Especially having gone through COVID as we're still dealing with it. We've got Linda Goler Blunt. She's the CEO of the Black Women's Health Imperative, and she can give us a sense of where we're standing with respect to Black women's health. Thank you so much for being here.
Well, thank you, Mayor Pat, for having me.
So what is the status of Black women's health in America? Is it way off base, or where is it?
The state of Black women's health is still being determined. We know, as you all do, that Black women suffer disproportionately the impacts of health disparities. We see it in breast cancer, in heart disease, diabetes. We certainly see it right now in COVID-19. But it's too early yet to see what that impact is going to be on the state. We are still discovering more and more about the impact that COVID-19 has had on Black women's health. But you have to add to that the economic impact, the job loss, which also is going to impact their health, loss of income, loss of health insurance, increased care responsibilities. So what we expect to see is increased rates of advanced breast cancer and cervical cancer because women have put off seeing doctors, and the kinds of diseases and effect of poverty from job loss and underemployment.
Well, if you had to do one or two things over the next few years, what would it be to have a positive impact?
Well, I'd certainly have to look at our health insurance system. We need to make sure that women have access to affordable health insurance. Employer-based insurance is great, but if you've lost your job or are working in the gig economy, you don't have access to that. So we've got to expand the exchanges. We need to expand Medicaid for low-income women. We need to make sure in all states, and we need to make sure that women who are pregnant or have given birth have access to Medicaid coverage 1 year postpartum, because so much of maternal mortality happens after the delivery of a baby and after 6 weeks. And we need to make sure that the kinds of job trainings and economic investment in communities are there so women can have access to the jobs that they need. And frankly, I would change education policy so that we no longer fund our public schools based on property taxes, because that certainly disadvantages low-income communities and makes it extremely difficult to ever rise out of poverty.
So it seems like we've got a really daunting task. The drivers are systemic racism, sexism, and economic disparity. How do you tackle all of those at once?
Well, your point, Karen, is of course spot on. We have to tackle them all at once. In Black feminist theory, we talk about intersectionality. Black women live at the intersection of racism, gender discrimination, and economic oppression. We cannot actually separate these things apart. So we have to look at what's required for healthcare access, what's required for elimination of poverty and systemic racism, and look at what happens to the fact that Black women, by virtue of being women, are discriminated against. So we have to look at those kinds of policies, and much of what the Black Women's Health Imperative does is work to not only advocate, but develop legislative language to make sure that the kinds of policies that we need to be as healthy as possible are in place. For
the disproportionately fewer African-American women who have access to health care, when they go to the medical caregivers, they're treated differently, aren't they?
They are, and it's really tragic. And to your point, it is for those women who have low resources or underinsured, but not entirely. This happens for women who have very good health insurance. We saw that in very stark relief last year with COVID-19. So many Black people showed up and didn't get the kind of care that they need. We saw David Bell die in the parking lot of a hospital after having been turned away 3 times. Dr. Susan Moore, a physician, could not get her medical colleagues to provide appropriate care for her. We see this in breast cancer and cervical cancer all the time. Providers are not making recommendations for the state-of-the-art cancer screening, and so Black women then end up getting their breast cancers diagnosed later when they're more difficult to treat. And we see it when Black women show up at the emergency department with a sickle cell crisis. Providers are likely to assume they're there to seek drugs rather than to get the care that they need. So we absolutely have to look at the practice of healthcare and take systemic racism and bias out of it.
Well, one can understand after your wonderful insights where you've really enlightened us on the many instances where Black women have been hurt by our own healthcare system, why imperative is in the title of your organization. It really is imperative. You've been terrific. We can't thank you enough, and we are very grateful here at State of Play.
Well, thank you for having me.
Welcome back to State of Play. As you know, we're drilling down today on the status of Black women in America, and we're also very excited and thrilled that we have Kamala Harris as Vice President and Stacey Abrams being considered for a Nobel Peace Prize. But we really need to have experts help us really understand this issue. We have one such expert here today, Farah Tanis. She is terrific. She is the founder and co-president of the Black Women's Blueprint. Wonderful to have you with us today.
Thank you for having me.
Yeah, so I think our audience needs to understand the great work that you're doing. So could you sort of elaborate on that?
Black Women's Blueprint, we are a national gender justice organization. We do the work at the intersection of racial justice, and we provide services. We conduct advocacy and education, all in service of empowering Black women across this nation.
Well, you know, we've seen that Black women have been a catalyst for a lot of positive things in this country, even in the wake of the 2016 election, not to speak to anybody's politics, but there was a lot of misogyny in that. But Black women were outliers. You know, we were the ones who stood up. Often Black women are the ones who are the catalyst, whether it's the Anita Hill period that ushered in women, into the United States Senate, or even now. But is that a misnomer that we have made these achievements? I mean, we're celebrated, but are we making progress?
You're absolutely right, Sharon. Today, Black women are one of the most active groups of voters in the country. We know this and we celebrate that. Black women and girls are creating greater opportunities for their communities through their leadership in social movements like Black Lives Matter, Say Her Name, the Breathe Act, the Violence Against Women Act, and of course, the fight for the ratification of the Equal Rights Amendment. However, Whether you're talking about Black women's access to healthcare, Black women's earnings, or Black women's access to much needed social supports like childcare and elder care, Black women are getting the short end of the stick, despite having contributed so much to the building of this nation. And the result is still a racialized healthcare system and a racialized economy where Black women are losing ground.
Well, these are great observations, and clearly these are appropriate initiatives that should take place. But how do we get buy-in? Buy-in even among African American men that Black women should be playing this kind of role, or among other women? Because, you know, Patricia Roberts Harris, one of my mentors, used to say when they said Black, they mean men. When they say women, they mean white. Black women are almost never included. How do we get the buy-in that we need from others?
I think conversations like this, I think dialogues across the country need to occur. I think when we talk about racial justice, and when we talk about police violence, and when we talk about economic justice, and even the impact of the COVID pandemic, that we need to look at the gendered ways that our oppressions show up, that policies impact our lives, that the lack of access and economic disparities impact the lives of Black women in particular. I think it's conversation, it's dialogue, and it's centering gender justice squarely within the broader racial justice concerns of Black communities.
You know, Black Lives Matter, by and large, has been, driven by women. You know, with so much of the turnaround in the political fortunes of this country, because, in 2016, Black women were still out there for Hillary Clinton when other women really abandoned her. Doug Jones's election to the United States Senate was basically a function of Black women. Black women, maybe they kind of get it because we are having a greater struggle. And therefore, we end up finding ourselves in positions of leadership. And to some extent, is that what you're saying? And that's where we find ourselves.
I think to some extent, yes, that is what I am saying. And even around voting, when you think of voter suppression, Black women, as you have said, with Stacey Abrams, that we've been at the forefront of policy demands like the For the People Act, which the Brennan Center said would bar virtually all of the voter suppression measures being proposed in state legislatures. Black women are at the forefront of Sunday voting, right? They're at the forefront of ensuring that there is no elimination of automatic voter registration and no blocking of the ballots. So I think that we have been at the forefront of several of these policy pushes. And in the future, we will continue to see that.
No, I think, and what you're doing is so terrific. And so this is an important subject. We're going to continue to drill down. So don't go away. There's more to State of Play. Well, I was born in Washington, D.C. I was a Black girl who was a Washington, D.C. resident, and I had no power. You aren't going to achieve change unless you do a very good job of sharing data and informing as many people as possible as to why change is upon you anyway. So are you going to shape it, or is it just going to overwhelm you? And that is the point of State of Play. Welcome back to State of Play. Our important subject today, the status of Black women. We have a wonderful guest with us, Farah Tanis.
Thank you so much for joining us. I read recently that you had a meeting with the National Organization of Women. Could you tell us a little bit about the meeting and what you hope to achieve and whether you've achieved it?
We've recently developed a partnership with the National Organization for Women in order to push them really to advance our agenda in their policy advocacy. This partnership is comprised of several conversations. So before the pandemic, we talk about Black women earning just 64 cents on the dollar earned by comparable white men. In addition, Black women were overrepresented in the service sector, doing crucial work to care for children and the elderly. And so these issues are issues that we want to see represented in policy. and the disproportionate ways they impact Black women. The National Organization for Women is pushing that forward. COVID cases in Black communities are 1.4 times higher. Hospitalizations are 4 times higher than the average population. Mortality is 2.8 times higher. Health access is an important issue for Black women that the National Organization for Women is pushing forth in their policy advocacy. Inaction could not only cost billions in dollars, but it could undermine Black women's economic security, food security, and it could increase homelessness and increase violence as well, and set gender equity for Black women back generations.
So even though Black women are responsible for electing a new administration and a Democratic Senate majority, are African American women still not getting their just due?
You're absolutely right. Even though Black women are participating in record numbers, Black women have really shaped the discourse around power in this country, we are not getting our just dues. We are not, for example, getting the reparative justice that is owed to us. And this is important as legislation focusing on how the US can apologize for slavery and make reparations to the descendants of slaves. There's been a renewed attention to that. However, the concern is always that Black women and our lived experiences historically and contemporarily have not been at the center of that conversation. Reparations would look different for Black women because of our gendered experiences with racism, with exploitation in reproductive health, and of course, sexual exploitation.
So with your organization, you're making certain that as these issues are addressed, that the plight of Black women, the role of Black women, the benefits to Black women must also be addressed. That's what I gather.
That's absolutely right. And that includes the issue of land justice, that includes access to food, but not just access to food in a way that is being given to us, but it includes access to land. At Black Women's Blueprint, we have just purchased 300 acres of land. And part of our work is to ensure that we not only transfer a portion of that land to Indigenous women, but we gift a portion of that land to Black women in particular so that they can build legacy.
You've made such wonderful points. We really need you. So thanks for being here on State of Play. So welcome back to State of Play. We know the topic, the status of Black women in America, and we've heard from Linda Goler-Blunt and we've heard from Farah Tanis, and they've given us some pretty staggering statistics. We know that Black women have become more politically active and empowered, but that hasn't always translated into programs and policies. But maybe I'm, too pessimistic. What do you think, Karen?
Well, Mayor, I mean, the facts and listening to Farah Tanis from the ground up, I mean, it's just compelling. I don't think you're being too negative, but I do think what we need to truly understand is not only how bad it is, because it is bad, but what it is that we can do, and what it is we all need to do to change the dynamic here. And
I don't think you're being pessimistic either, Mayor. I mean, we've all seen historically all of the fits and starts. Something gets going, and at a time like this, especially at this moment of reckoning in America, you wonder whether this is going to be ongoing and consistent. This is not something that can happen overnight or be a Band-Aid. It has to be something that is sustained, an ongoing interest, in fact, in improving the well-being of African-American women, not just something for people to say in this moment, in the advent of both the pandemic and the police demic.
Yeah, because African-American women were so powerful in the 2016 election, not enough others joined them, but also in the 2020 elections, That's why Kamala Harris was really on the ticket, as it turns out. I mean, Black women have gained in terms of political significance, but we see a tremendous pushback in this country around voter registration, voter participation.
Right.
The one vehicle that people have to have an impact and to translate that into programs and policies that will help Black women, now we're getting pushback on that very one vehicle. But, we're going to hear from others, I know, who will talk to us about the economics and give us the real deal on the data and talk about the future. But that's, I guess, where we need to go. I welcome your thoughts on that, Karen.
Well, no, I think Dr. C. Nicole Mason, who's coming up, will really provide the facts that we need and the data that we need. But what seems to me we also need to understand is it matters to all of us, right? Change matters to all of us. I mean, as a society, we heard from these two experts who made it clear we are all suffering because of systemic racism, sexism, and the economic disparity. The depth of the economic disparity is appalling.
And I think we've seen more and more since 2016, even after the Women's March, that Black women have taken the lead to the point where even the feminist and womanist movement, white women have had to take many cues from Black women, when it comes to voting, when it comes to all of these issues. And I think that's a good thing. So where Black women are leading, we should follow. Where Black women are being affected, we should go.
Well, I think Karen and Mark, you're both on point because the pain is felt most often and most severely by Black women. In many ways, we're like the canary in the coal mine. We're the ones who are letting the world know this is a problem. Well, thank goodness for that. Early insights don't go away. We've got more to talk about here on State of Play. Welcome back to State of Play. We're very fortunate indeed to have with us Dr. C. Nicole Mason, who is the CEO of the Institute of Women's Policy Research. She's also an author of the book, Born Bright, A Young Girl's Guide from Nothing to Something in America. Very fortunate to have you with us. Thank you, Dr. Mason.
So good to be here.
So you've done a lot of examination and study of the implications of the pandemic, the implications of the recession, and particularly how it's impacted women, and especially women of color. Can you sort of elaborate on that?
Yes. So at the start of 2020, we were celebrating a milestone. Women were 50% of the workforce. And when the pandemic hit, it wiped out all but wiped out those gains. And so we lost about 2.5 million jobs in February alone. And since the start of the pandemic, women have lost more than 5 million jobs, nearly 4 times as many jobs as men. Many of the women who have lost jobs are Black and Latino women because they are overrepresented in the hardest hit sectors. Service, leisure, hospitality, education, and healthcare services have been really hit hard in this moment.
So some of these losses, I imagine, are directly attributable to the fact that people can't be in person, that is hotels, restaurants, and maybe some of those jobs will come back. But some of the job loss is a shift in the economic landscape where we're moving sort of towards a virtual society. Could you sort of weigh in on that?
So automation and moving to a virtual, more automated world is impacting women in the workforce. But what is it during the pandemic? What has really impacted the economy and women in the workforce is the implementation of stay-at-home orders and in those hardest hit sectors. But another chief factor is childcare responsibilities. When schools closed, and then in August, for example, we believed that they were going to reopen and they didn't. 865,000 women exited the workforce in September and August alone, mainly due to caretaking responsibilities.
So, Dr. Mason, I want to ask you, what do we do now? And in particular, what policies need to be enacted beyond the recovery? And how is it targeted so that women of color actually benefit from the policies?
So the American Rescue package plan is a really good step in the right direction. It's very ambitious. It matches the magnitude and the size of the problem. And there's a lot in there for women of color, lower wage workers who are struggling in this moment. So there's housing and food assistance. The child care tax credit is also really important in this moment and has the potential to pull about 45% of children out of poverty. The direct stimulus payments will go a long way in this moment for families. When I look and think future, making sure that we get a robust infrastructure package that targets the hardest hit sectors, and also those who have been hit hardest, women of color, have disproportionately lost jobs, making sure that they are targeted in relief efforts.
Dr. Mason, can there be a rescue from the She Session for women of color and long-term economic repair for women of color without increasing the minimum wage?
Absolutely not. So raising the minimum wage is critically important to this in this moment. IWPR did a recent survey, and for Black and Latino women, raising the minimum wage was in the top 5 issues. For Black women, it was number 2 or 3, right behind racial equality and injustice. Raising the minimum wage will have the benefit of moving a lot of women and families out of poverty. But for Black women and Latino women, Black women specifically, they make up a huge chunk of breadwinner mothers in families, meaning that 40% of their income accounts for all of the household resources and earnings. And so it would go a long way. Raising the minimum wage would go a long way to supporting and helping those women and families.
Well, I'm excited about raising the minimum wage, but what good does it do, Dr. Mason, if the jobs have vanished? I mean, if they're being replaced by artificial intelligence, and what motivation is there for the private sector to spend the money to educate and retrain women so that they can return to the workforce?
So the good news is that in some of the hardest hit sectors, the human service sectors, the high touch sectors like service, leisure, and hospitality, those jobs aren't going anywhere. Women make up a large chunk of those workers. And so, but what we have seen is that some private sector companies like JP Morgan Chase and some others have really worked to reskill their workers so that they can enter new parts of the company, as automation, becomes an integral part of their business plan or model. What I know for sure is that there isn't going to be a need for education and training, especially because some jobs have disappeared for good. So in the infrastructure package that will be proposed over the next couple of weeks, making sure there is a set aside for education and training for those women who have been forced out of the workforce.
Who should shoulder most of that? Do you think it's going to have to come from the federal government? Because not every member of the private sector is going to step up and do this.
I think it's a combination of both. I think the federal government has a role to play, and the private sector also has a role to play. And what I've seen over the last several months is that some private sector firms and businesses have stepped up to the plate and made their workplace policies and practices more accommodating for women workers. They've also, instituted hiring programs to support and reskill workers. So I do think that we'll need more of that as we move forward, but really optimistic about what's happening at both the federal level and and in the private sector.
So hopefully you and others like you are going to play a pivotal role in helping to shape the policy and programs. Any indication of that with the few seconds we have left?
So what I'm really excited about and energized about this moment, it's tough, there's no doubt. But what I'm excited about is that there are a lot of women of color, myself included, who are in these conversations about necessary policies. Cecilia Rouse was just confirmed as the, head economic advisor to the administration. That's a first and amazing. And she's smart and has, the experiences of Black women, communities in her mind when she's thinking about what kind of economic policies will restart, jumpstart the economy. So,
well, you've been great. We've run out of time, unfortunately, but thank you so very much for being here on State of Play.
Thank you for having me.
Welcome back to State of Play. Our topic today, the status of Black women in America. We now have someone with us whose organization, Goldman Sachs, has a major initiative to help 1 million Black women over the next decade, spending $10 billion over the next decade, about $1 billion a year. Margaret Anandu. Margaret is the head of Global Impact, Sustainability, and Asset Management. It's a real joy to have you with us.
Thank you so much for having me, Mayor Pratt.
So as I understand it, I know that Goldman has earlier had initiatives around women, particularly women of color around the world. But I gathered in the wake of the George Floyd killing, your CEO hosted a virtual town hall, and out of that came this very specific initiative of helping 1 million Black women. Is that a fair characterization?
You're right, Mayor Pratt. We had a global town hall back last year, and this was our CEO, our entire workforce around the world, in a really difficult discussion around the challenges that we were seeing, the murder of George Floyd, just really how our own internal community was dealing with it. And one of the outcomes of that discussion was knowing that we wanted to do more. And he challenged myself and a group of us around the firm to say, what can we do to really contribute in this moment in a meaningful way, in a lasting way? And that's what started a lot of the brainstorming and putting together the initiative 1 Million Black Women, which we announced a couple of weeks ago.
Well, I know that you've assembled some extraordinary individuals to help guide you. I mean, Condoleezza Rice, Mark Morial, Melissa Bradley, and others who are terrific, Sir Ruth Simmons. But this is really quite a stretch for Goldman. You have a real broad focus. I mean, it's housing, it's access to capital, it's childcare. How do you think you can have an impact on so many spheres of life of African American women?
First I'll just comment quickly on why it is so broad. We're a very data-driven firm, and so we started with the research. And so part of the announcement, we released Black Womenomics, which is a research report which really studies the wealth gap for Black women. Just in 2019, Black women with a full net worth, everything they own, of just $7,000. And that's relative to white men at $92,000. And when you start to unpack that wealth gap, you see that in every facet of our society that really contributes to building wealth and economic mobility, that's housing, that's education, that's healthcare, that's financial health, that's access to capital. It's all of those things where we see either Black women showing the most significant disadvantage or very close to it. And so as we thought about how we wanted to approach this really significant issue, we want to invest across all of those areas. We thought, quite frankly, about going very deep in just housing, or really going even deeper on the small business work that we've been doing for 15 years now. But we thought, in this moment, let's be holistic. We have to acknowledge that all of these challenges are connected, and even very strong solutions in one area aren't going to be and provide the lift that Black women need across the table, right? And that's as mothers, as business owners, as community leaders, as professional anchors, as mayors. And so we're doing what one of our advisory council members, Darren Walker from the Ford Foundation, he said, do the hard thing. Don't be dissuaded. This is hard work. If we didn't need this work done, we wouldn't be in the situation that we're in now. So we're investing across all of those spaces. And this goes back to the challenge from our CEO. What's the unique contribution that Goldman Sachs can make in this moment? And for 150 years, we've been investing, we've been helping ideas and companies grow and scale. And so what does it look like to work with companies, partners, lending facilities, research institutions, all with this very clear lens of narrowing its opportunity gaps for Black women.
And you're working with retail partners, I gather, people who know where the rubber hits the road, who've been on an ongoing basis dealing with the needs and concerns and making capital available to African American women. Is that right?
Yes, that's the healthcare organizations and clinics that we'll partner with. That's community development financial institutions in Black communities across the country that we've worked with over 10 years. That's the venture funds who are focused on, Black female-led companies. So it's a range of partners, given the range of impact areas, but we know we can't do this work alone. And so we're making new partnerships every single day. We think that's going to be the real secret sauce that drives success here.
Well, that sounds good because that's what is needed. As Cuba Gooding Jr. said it so perfectly, show me the money. And that's really the need in so much of the Black community and for so many African American women. So don't go away. Come back here to State of Play.
I think I always wanted to make a difference. I wanted to go into government to have a broader impact than I could have ever had as a litigator. I had in the Clinton administration a really broad reach on public policy issues. Hopefully I can bring some of that experience to State of Play.
Welcome back to State of Play. Our topic, the status of Black women in America, and our guest, Margaret Anadu of Goldman Sachs. My colleagues have some additional questions for you. Karen?
Margaret, this isn't typically what Goldman Sachs does. Goldman Sachs invests money and expects a return on that investment. What does Goldman Sachs expect now for its investment?
Sure. I mean, this is consistent with how we approach all of our investing, right? We, in our work, and I've been investing at the firm for close to 20 years, we're always looking for the best ideas to scale and grow and put resources behind. And so as we think about the effort here, companies, lending facilities, partnerships, organizations that are going to support Black women, we think that's an excellent investment, both the investments that we're going to make directly in Black female-led organizations, but also in the housing, the healthcare opportunities, the educational opportunities that support Black women. We think those are going to be incredibly compelling opportunities as well. So in a lot of ways, I'd say it's no different. I think what's different is just the intentional lens we're applying to it and the focus on those sectors that were identified in the research.
So this is a private sector initiative, not a public sector initiative. So how do the people hold Goldman Sachs accountable to do what it says it's going to do?
I mean, one of the things that we're really excited to do is really share the work. We want to talk about the investments that we make. And importantly, we want to talk about how we track towards that 1 million Black women. We have experience with this. So whether it's our initiative, 10,000 small businesses, Mayor Pratt mentioned earlier our work around the world with 10,000 women. In all of those signature economic development initiatives, we said, hey, this is our target. This is what we're trying to accomplish. And we want to talk very transparently along the way about how we get there. Importantly, with this initiative especially, we want to highlight commercial solutions that narrow opportunity gaps for Black women. We want this work to be catalytic. We want to have partners come alongside us. And even beyond just the individual transactions, we also want to make a statement about this framework. What does it look like when one of the ways that you judge an investment very specifically is how it impacts Black women? That's a new lens, that's a new model, and we think it's one that can be adopted, quite frankly, for other underserved groups as well. So we're excited to talk about this and be very open and accountable to what we've said we're going to do.
Ms. Anadu, the plantation economy, the enslavement economy established Wall Street in the first place. Shouldn't we see what you're doing as actually a return on the investment African American women originally made during enslavement?
I think the historical context here and the complex challenges that Black women and Black households have faced in this country for hundreds of years are certainly part of the backdrop of the disadvantage that Black women face in the country today. And I think what's exciting here is the opportunity to use capital and use investment to really push us forward. Black women today we're leading. We're mothers, we're business owners, we are community leaders, we are community anchors. And I get so excited thinking about just the level of opportunity we can.
You've been great. It's been an honor to have you on State of Play. Sorry to interrupt, but thank you so much. So welcome back to State of Play. We've had a rich conversation about the status of Black women in America, and some of the statistics are pretty staggering. We've got a sense of the health of African American women, the economic plight of African American women, the intersectionality of race, gender in this country. Now, we have some hopeful signs with Goldman, but, translating that into reality. It's been a unsettling conversation in some ways, don't you think, Karen?
Mayor, it has been unsettling. And it's sort of hard to imagine the policies, the depth of the policies, the comprehensiveness of the policies that would have to change to make this situation different than it is right now. And it has been historically just very, very bad. And it's shameful that we only, are acknowledging it now in 2021.
And Lord knows African American women deserve all this attention. It was, after all, Malcolm X who said that the Black woman is the most disrespected woman in America. And when we think about all the topics we've covered, in each of these fields, if it were not for African American women, none of these fields would exist. Even when we talk about healthcare, it was African American women who were experimented upon during the enslavement period to develop a lot of the health treatments when it comes to overall women's health. It was African American. We talk about Goldman Sachs and capital investment. African American women were the capital that actually established Wall Street. So there's still a ways to go. Mayor, and what I just heard you say, you implied that even when it comes to the reinvestment or the investment, you're a little concerned about whether or not it'll really hit the people who need it most.
Oh, we've had this conversation for a long time. This is not a new experience in America. We know, as you pointed out, African Americans and particularly women were the vessels by which to keep this human capital going. During slavery, then you had Jim Crow, didn't participate in so many of the aspects of growth in this country. And there's a sensitivity on the part of women generally, whatever the race, and then particularly African-American women, to raise the point of, why aren't you talking about me? Why don't you have programs customized to deal with my needs? And so I guess that explains why we're still struggling with it in this year of 2021.
If we look back, African-American women not only played this essential role in the economy, but an essential role in our democracy. Where would we be without African-American women today? And I literally mean today, after the 2020 election, or looking back at the Georgia election, or even back in Alabama in that election, and not to mention the House and the Senate. I mean, truly, if it were not for African-American women, I'm not sure who the president of the United States would be right now.
No question about it, Karen. African-American women have helped save the country politically. And it was African-American women who, after all, let's be honest, launched the very Me Too movement itself. So African-American women have helped save this country.
Black Lives Matter, you name it. So I'm glad folks were here to talk about the status of African-American women on State of Play.